All right, everyone, welcome back. My name is Brandyn Dunn. I'm a facial plastic surgeon here in beautiful Newport Beach, California. Today, we're going to be talking about face and neck lifts. Let's go. A facelift and a neck lift are probably one of the most powerful, popular procedures that I perform in my practice, and something that I just love performing. So let's jump into the details of what to expect. What are the positives and negatives? What are the downsides of this procedure? What are the potential risks? And what to expect throughout the recovery process. I want to make sure that you feel comfortable and confident in your decision. So the technique that I like to perform is called an extended deep plane facelift. So what does all that mumbo jumbo mean? An extended deep plane facelift and neck lift are oftentimes performed together. What it does is it addresses the lower face as well as the neck. It helps to create more definition, contour, and move the fat and up to a more youthful position where they previously were. So let's talk about the procedure. So this is a procedure that is, I would say, one of the more involved procedures that you really need to be invested in. You know, it's not like getting your nails done. It's not like getting your hair done. This is something that has significant downtime, significant recovery, and significant financial, emotional, and physical healing. So if you're thinking about it, you really have to kind of go all in. You can't just kind of be on the fence with this type of procedure. I will say that there's people out there that advertise mini this, mini that. It's more just kind of marketing and advertising to kind of get people in the door. So how do you decide whether you're a good candidate for this procedure? Obviously, a consultation is probably the most important thing, but I would say, you know, the age range is actually pretty vast. I would say the typical range is between 40s and 60s. That's when most of the patients are getting this. This is when they're overall healthy, they have early or middle signs of aging, and their skin quality, their quality of their tissue and everything is still very healthy and vibrant. I have performed deep plane face and neck lifts on patients that are younger as well as older. And so that's not to say that those other extremes are not necessarily a feasible time, but you know, the 40s to 60s is the most common window when people start thinking about this procedure. So if you're bothered by heaviness in your cheeks or deepening of your smile lines or your nasolabial fold, or you feel like you start to see jowling along your jawline, where your jawline is maybe not as smooth or as sharp as it used to be, or you're beginning to see some laxity in your neck, kind of collection of skin, muscles, or fullness in your neck that you're bothered by, then those tend to be the patients that are most suitable for this procedure. If you look better when you kind of pull and lift your face in this natural direction, this vertical vector lift, then you're probably starting to kind of be in that time zone when you are kind of a good candidate. So let's talk about the incision, because that's one of the biggest concerns that most patients have. They want to have this procedure done, but they don't want anyone to know about it. And I get it. You just want to kind of look like you woke up that next day and you feel refreshed, you feel youthful, you feel like you went on a nice long vacation and you're feeling great. Although they're long, they're placed in areas so that they're hidden in natural transition zones of your face and your neck. And that, again, they're long, but they're there so that they can be hidden. So it starts in front of the hairline in this area, kind of around the temporal tuft of hair here. Then in front of the ear here, oftentimes behind this piece of cartilage called the tragus, around the earlobe, back of the ear, and back of the hairline, as well as an incision that's underneath the chin that allows me to get access to sculpt and kind of refine the muscle and fatty tissue in the neck. These incisions are closed under minimal tension, which allows the results to be as optimal and as beautiful and perfect as possible. The next big concern that most of my patients have is the downtime. There's social downtime and physical downtime. Social downtime for most of my patients is anywhere from 2 to 4 weeks. And that really depends on you and as well as your overall healing. So I've had some patients, actually I had a patient the other day that went out to lunch 4 days after her procedure. I will tell you that is an extreme when it comes to being that comfortable that early, but most patients start to feel comfortable anywhere from 2 to 4 weeks. You know, your incisions are still going to be visible. You can wear your hair down. You can kind of get out and about and do things that you start to feel comfortable with. I would say the big thing is that giving yourself grace, letting you have yourself some time to heal and recover and not expecting you to kind of get to the front of the line as quickly as possible. If you do that, you will recover probably even faster. What does the recovery process look like? Bruising and swelling is very, very common with this type of procedure. It's a fairly involved and invasive procedure, and so it's very normal to expect to see bruising along your cheeks, some swelling and bruising under your eyes, along your jawline, and into your neck. Bruising typically transitions from red and purple to yellow and green, and then it evolves over time. Most of the bruising and swelling is kind of correlative with the social downtime. So most of the bruising and swelling is gone at the 2 to 4 week mark. Everyone's a little bit different. The next one is physical downtime. So physical downtime is obviously very important for most of my patients because most people that are coming into my office that are thinking about this procedure are healthy, they take care of themselves, and they're physically active. And so I will tell you that everyone is always trying to find out when is the next time that they can go on a walk, go on a run, go on a hike, go on a bike ride, whatever it may be. Give yourself some time to recover. You start to get back into those physical activities around 2 weeks, maybe 1 to 2 weeks. Then you slowly increase it over time over the next 4 to 6 weeks. By 4 to 6 weeks, everyone is back to their full physical activity and you're able to get back to everything. So trust the process, it'll get better. Another very important component to the healing process after a lower face and neck lift is a compression dressing. So after the first day of the procedure, I will have you come back to the office and I'll take off the compression dressing that I place immediately after surgery. That first night, you feel a little bit stuffy, you don't feel super comfortable, you can't really get comfortable and you're kind of moving around the whole night, just not feeling your best. After that, I place on a new dressing. It's kind of a compression dressing to kind of make sure everything kind of stays tucked in and in position the way that we want it. You will wear that 24/7, 7 days a week for the first week, except for when you're showering or cleaning your incisions. Other things that help to move that swelling along, other than the compression dressing, is ice, sleeping elevated, and avoiding salty foods. Your diet is actually very important during the first couple weeks because your body retains fluid a lot more differently actually after this surgery. And the reason is because you've had trauma to your body, surgery, and you retain fluid and there's a lot of hormones, there's a lot of things going on in your circulation that causes you to swell and retain fluid. So if you avoid salty foods and you overall eat pretty healthy, that will help with the swelling kind of coming down even faster. So another big component to this is when is your final result? And that's something that's important to understand because as I said in the beginning, this is a journey. You got to understand that there's a process, an ultimate healing process. So final results are typically around the 3 to 6 month period. And the reason this happens is because the lymphatic channels, which are basically the channels under the skin that helps to mobilize fluid and scar tissue and all this different type of stuff that goes on after surgery, takes about 3 to 6 months for things to come back to normal. So at that 3 to 6 months, most people find that most of their swelling, most of their numbness, most of kind of the healing process has fully resolved. So the next question that everyone always asks is, how long do these results actually last? And it's a great question. And I think it's important something to discuss. The results last very different for everyone, and it's really based on maintenance. I will tell you that if I do the same procedure on the same person or a twin even, and you compare them, based on how they maintain their results, their skincare, exposure to sun, diet and exercise, weight changes, all of these different things will fluctuate and change how long your results will last. I will tell you that if you maintain your overall health, your well-being, and you feel good and you take care of yourself, generally 7 to 15 years is the timeline where most people will say, I'm still happy with this. But the more importantly, what ends up happening is if you had this procedure done today, in 10 to 15 years, you will look better than if you hadn't had the procedure done. So it's not that aging doesn't stop when we do this procedure. The big thing is that aging ultimately kind of continues to happen, but you're kind of set back a few years. So if you're thinking about having a facelift, or you have a lot of questions about having a facelift or a neck lift, or you want to know whether you're a good candidate, the best is really to get a consultation from an expert that understands facial anatomy, facial aging, and whether this is the right procedure for you. So if you think I'm the right surgeon, I'd love to see you in my office for a consultation, and I hope to see you guys soon.